Hello and welcome to Cure Connections. I'm your host, Dr. Philippa Cheetham. Hearing that you have any type of cancer is obviously devastating and overwhelming. Bladder cancer, in particular muscle invasive bladder cancer, can be one of the most challenging cancers to treat. In addition to chemotherapy and radiation, bladder cancer may require complex, lengthy surgeries, both to remove the cancer as well as restore urinary function. Thankfully, however, there have been many advances in the field recently, including immunotherapy, that are helping people with bladder cancer live longer. Today, we are very pleased to have Michael and Sandy Molnar here to share their journey with cancer. Michael was diagnosed with bladder cancer in 2014. Also with us here in the studio today is Michael's oncologist, Dr. Elizabeth Plimack. She is Chief of the Division of Genitourinary Medical Oncology at Fox Chase Cancer Center in Philadelphia. Later in the program, we will also be joined by Jean Marie Wheatley, a registered nurse who works with Dr. Plimack in the clinic at Fox Chase, and Dr. Stephanie Cheetham, who is Director of Education and Research at the Bladder Cancer Advocacy Network. Thank you so much for joining us here on Cure Connections. Welcome to the panel, Dr. Plimack, Michael, Sandy, welcome. Thank you so much for joining us here today. Elizabeth, we hear a lot about different cancers, particularly prostate cancer, breast cancer. It's in the news. Patients are very familiar with these, and we know that these are extremely common cancers. We don't hear so much about bladder cancer, and yet this is not a rare cancer, is it?
It's not rare at all, and you're absolutely right. It's one that gets limited attention. It's the 5th most common cancer. It does affect men more than women, although women are often diagnosed later because of the way symptoms present and differences in those workups. Most bladder cancer can be contained and is content to sort of reside in the bladder and doesn't spread. And I think that may be why we don't hear about it as much. It's more rare for bladder cancer to spread outside the bladder, but it certainly happens. And we're active in research and investigating better ways to treat it once it spreads.
And we're going to hear about Michael's story shortly, but bladder cancer, like many cancers, there are risk factors for patients getting bladder cancer. We know we pick up cigarette packets and you see the warnings about smoking causing heart disease, smoking harming your baby, smoking causing lung cancer, and yet smoking is a big risk factor for bladder cancer, yes?
Absolutely. Smoking, it's amazing how many ways smoking can damage the body for something that used to be very common. Unfortunately, it's a less common habit, smoking, at least in the United States. I have seen bladder cancer warnings on cigarette packets in Canada recently, so I think that's a nice step forward. But knowing that if you're a smoker, please quit. And if you do smoke, you have to be aware of symptoms not just of lung cancer and heart disease, but bladder cancer as well.
And I think it's fair to say, isn't it, that most people don't know about the strong association between smoking and bladder cancer. Why do you think it is that it's so underreported that bladder cancer is so commonly associated with smoking, and yet there's so little awareness about that?
Right, I think probably lung cancer makes sense. Smoke goes into your lungs, and so it makes sense logically that that would cause lung cancer. I think what's less understood is that the toxins from cigarette smoke filter through the bloodstream and out through the urine, and so kidney cancer and bladder cancer are also very common in smokers and associated with smoking.
And certainly for patients of mine who've had bladder cancer, they may have been smoking for many, many years, and they then are diagnosed with bladder cancer. And it's so difficult to explain to patients that even though they may have been smoking for many years and they've been diagnosed, there's still value for patients to stop smoking even though they've been diagnosed, yes?
Absolutely. I mean, the last thing, when we treat someone successfully for bladder cancer, we want to see is a new lung cancer, right, or heart disease or a new problem.
And also in terms of the outcome for that actual bladder cancer?
For sure. So surgery, surgical outcomes are better in non-smokers. They're healthier to begin with. So any day, the day you quit is the day your health starts improving. And so there's no time that's too late.
Michael, you were diagnosed with bladder cancer in 2014. Tell us about the initial way that your symptoms presented.
My symptoms presented themselves first. I didn't think of it as a symptom. Frequent urination, traveling on the road, drinking coffee, not necessarily eating breakfast. That particular lifestyle, having to urinate often, I pretty much nearing the age of 50, I thought was more or less normal.
So at that point, you didn't have any pain or any blood in the urine or anything like that?
No, didn't think anything of it. I figured I was getting older. And the more it progressed, not that I really ever gave it a second thought. The first time that I really worried about it was I thought I saw like maybe perhaps minute particles in my urine. It wasn't blood, it wasn't red and came out, and it was very little, almost like little fleshy pieces. And it concerned me, but I kept my eye on it for, that happened one time when I urinated. My next urination, nothing for weeks, nothing. And I was worried, but I was like, took a deep breath and relaxed a little bit. Okay, whatever it was, it's gone. Until it presented itself again 2-3 weeks down the road. And this time, not so small. I could notice the particles, and they had a little bit of red, dried up red blood on the end of the white meaty part, if you want to call it. But these particles persisted. They kept coming out, but they would take weeks off. I would notice it.
So your symptoms would come and go?
Come and go. I would notice it, and every time I noticed it, it was a little progressively worse. At that point, I knew I had issues. I knew I needed to see a doctor, but like in everybody's life, life got in the way. And my daughter was graduating, I was going to be out of town. Always made reasons for not going when I had the opportunity because of different issues. But when I did make my appointment with the urologist, he says, well, what are your symptoms? I told him what my symptoms are. He said, well, if you have a couple moments, we could scope you right now.
So Sandy, we've already heard from Michael that he noticed some particles, some debris in the urine, and then some few specks of blood here and there that came and went, kind of passed it off as probably nothing to worry about. When did you first realize that something wasn't quite right?
Well, you have to understand that Michael really does not like hospitals and doctors, and I had been telling him, frequent urination really isn't normal.
I do now. I do now, like doctors.
And that he should get this checked out. So I had no idea that any of the particles were showing up in his urine or any blood or anything like that. But when he finally gave in and said, yeah, I guess I should go see a doctor, then it was evident that
she knew something was wrong if I was saying
not quite right now.
And Dr. Plimack, we've already heard about blood in the urine, a very common presenting symptom for bladder cancer, both superficial bladder cancer and then potentially even more advanced bladder cancer. But many patients assume that because the blood in the urine is painless often, that may mean that it's less of a concerning symptom, which always surprises me. But it's not common always to have pain with blood in the urine associated with quite a serious diagnosis.
Correct. I mean, one of the evil things about cancer is it does sneak up on people. That's part of what it does. Many cancers do that. Bladder cancer is one of them. So fortunately, some bladder cancer will produce blood in the urine, which is the first symptom or signal that people see. But there are lots of reasons, other reasons for frequent urination. There are fewer reasons for blood in the urine, but people often, can blame it on other things, especially if it gets better. Right? If they have it once and then it gets better, I think it's human nature to sort of say, oh, well, whatever it was has been resolved or has been fixed.
So urinary symptoms, we know that a lot of patients would attribute that to simple things like possibly a urine infection, cystitis, or even to certain foods that they may have eaten that may aggravate their bladder symptoms. What other symptoms might we expect patients to report in the early phase of diagnosis other than blood in the urine?
Honestly, not many, and that's part of the problem. I think if there were more symptoms associated with early stage bladder cancer, we would pick it up sooner. But particles, debris, frequent urination is actually less common. Blood in the urine is the most common.